Hi everyone, my name is Rachel Timms, and for my social work conference presentation, I'll be presenting on foster care youth who reside within group homes. More specifically, the target population is foster care youth within Santa Barbara County, California, who are placed in local group homes. So to begin, I will start off with a summary of my Part A treatment proposal. So many youth within the foster care system face frequent placement changes, lack strong or supportive relationships, struggle with their education, experience rates of homelessness, and have experienced adverse childhood experiences that negatively impact their physical and mental health. With the hindrance of support, consistent changing environment, and lack of coping skills to deal with their own emotions, many youth within the foster care system face unmet mental and behavioral health needs. Therefore, my suggested thesis is foster care youth have difficulties identifying their emotions, thoughts, and behaviors due to past traumas and experiences. Therefore, psychotherapy within a group setting would be beneficial for a multitude of reasons. Some reasons including community, supportive relationships, developing coping skills, and identifying and working through troubling emotions. The demographic for the population I'll be specifically targeting will be the approximately 500 foster care youth located in Santa Barbara County, including school-aged, preteens, and teens that are primarily Caucasian or Latino in this community. More specifically, I'll be targeting the 40 youth who are placed within group homes. Next, the intended intervention is psychotherapy. Psychotherapy helps the development of problem solving skills, allowing the participants to become more confident and self aware. The impact of psychotherapy will aid in youth feeling a sense of belonging, community, learning new coping skills, and tools to identify their emotions and behaviors through building relationships and learning about themselves. All in all, the treatment group will implement a therapeutic intervention that will utilize psychoeducation to provide the patients with knowledge surrounding behavioral and emotional patterns. Similarly, it will provide the patients with social, emotional, life, and coping skills to carry to other facets of their lives. So, next off, I'll be talking about the summary of my Part B treatment proposal. First, the overall purpose of this proposal is aimed towards supporting the mental and physical well being of foster care youth. In fact, up to 80% of children in foster care have significant mental health issues, compared to approximately 18 to 22% of the general population. These cognitive psychotherapy groups will allow the foster care youth to feel a sense of belonging, community, learning new coping skills, and identifying their emotions and behaviors through building relationships and learning about themselves, thus providing the target population with social, emotional, life, and coping skills throughout their lives. The rationale for choosing this population stems from data from the foster youth continuum of care reform. With that being said, youth who are exiting the foster care system often lack strong and supportive relationships. Thus, many youth exit the system or group home without the support or guidance to successfully transition. The overall objectives for this group are to meet the youth where they're at, create a healthy and supportive community, develop helping coping mechanisms, and being able to speak on behavioral or mental health supports. Moving on, the intervention plan is based on the fact that we never know how long a youth will stay at a facility. Therefore, the group sessions will occur weekly, one time a week, for the duration of the youth stay at the group home. However, youth will be encouraged to continue attending. Next, let's look at the rationale for the need of cognitive psychotherapy for foster care youth in group homes within Santa Barbara County. As stated previously, there are approximately 40 youth who are placed in residential facilities because there are not enough family placements. Similarly, a study conducted by Chang found that most participants who were placed in group homes had been struggling with trust, abandonment, attachment, and mental health issues. The study concluded that in order for these youth to be successful outside of the group home, it is vital to promote easier access to resources. It was recommended that assisting the youth in identifying previous trauma experiences will aid in the youth having a better understanding of their behaviors and challenges. So, why group cognitive therapy? Well, studies have shown that youth in foster care engage in high-risk behaviors such as violence, substance abuse, and/or are in and out of the prison system. Similarly, studies emphasize that youth within the system also struggle with trust issues, anxiety, and a lack of a support system, thus resulting in attachment tendencies. So, group cognitive psychotherapy will help youth learn how to develop problem-solving skills, build a pro-social environment, a community, build supportive relationships, become more self aware, and connect or learn more about themselves. Now let's take a look at the new slide, which is evidence-based relevance to social work interventions. As mentioned previously, the intended social work intervention is group cognitive psychotherapy, which is a combination of both cognitive behavioral therapy and psychotherapy. So for foster care youth within a group home, a mix of both of these therapeutic modalities will aid in reducing negative thoughts, reactions to stressful situations, identifying coping skills, and understanding their own behaviors and emotions. By providing youth with group cognitive psychotherapy and support, it is projected to provide preventative social skills and influence pro-social behavior, which helps children make better choices and cope better with everyday situations, life transitions, and placement stability. Similarly, it has shown higher success rates with youth being more apt to succeed later in life, school, home, and into adulthood. Moving on to the group evaluation. So listed are the objectives mentioned earlier, and as meeting each objective is unique to the person, this makes it difficult to evaluate and measure these objectives. However, a few ways that I plan to measure the effectiveness of the objectives include one-on-one meetings with the youth after the required 6 sessions and requesting that the youth take an anonymous survey. Questions that will be asked of the youth after the 6 sessions include questions like, what did you get from the experience, or do you have any key takeaways that you can utilize outside of these sessions? Similarly, questions on the survey will include, how are your comfort levels throughout the 6 sessions? How was your experience? Did you feel supported or a sense of community? And are you planning to continue attending the weekly recommended sessions? These tools will prove to be a beneficial point of progress as growth is not linear and progress does not look the same for everyone. After collecting these surveys and having each individual conversation, the clinicians can come together to rework the therapeutic sessions if needed. Again, the ultimate goal is to show foster care youth located within group homes that there are tools and resources out there that can assist them, which leads us to our slide of community collaboration. So some of these tools may be internal, however, some may be external through the county level. Some internal tools are building coping strategies, a supportive community, or processing or handling emotions, whereas some external tools are the Santa Barbara County Behavioral Wellness Department, Santa Barbara County Educational Department, or California's ILP or Independent Living Program. So, what will the group provide to the community? It will provide less foster care youth returning to the streets, more foster care youth graduating high school and are pursuing higher educational opportunities, a lower percentage or risk of engaging in high-risk behaviors such as violence, substance abuse, and in or out of the prison system. Overall, ensuring the youth leave the group feeling a sense of confidence and understanding how to process and deal with their emotions is important. This is a basic tool that will assist the youth throughout their transitions from placements and or life outside of the system. Thank you all for listening, and here are the references.